All right. Our last presentation is focusing on risk factors, study from regulatory partners. I'm going to hand it over to the moderator, Donna Wanucha, Retail Food Specialist in the Office of State Cooperative Programs with the USDA. Welcome, Donna.
Thanks, Tricinda. Thanks, everybody. I'm really happy to be here today to introduce our next speakers. Heather Sanders with the Pennsylvania Department of Agriculture and Morgan Lowder with the South Carolina Department of Health and Environmental Control. They'll be discussing how they conducted their first data collection in their risk factor study, or Standard 9. If you recall Mary Beth Neeson's presentation yesterday on the new flexible funding model, performing a risk factor study is an important milestone that must be met before moving further into additional funding. But more importantly, Standard 9 is an important standard to work on early in your program standards journey to measure the effectiveness of your program on reducing the occurrence of the foodborne illness risk factors. So this is a timely topic for discussion today. Heather and Morgan will do a short overview of how they conducted their studies, and heads up, they took different approaches. At the end of their overview, we'll have a couple of discussion questions, but also please go ahead and put your questions in the chat and they'll be answered either live or after the presentation. So let's get started. Heather and Morgan, welcome.
Thank you, Donna, for that introduction. Like you said, we're going to be discussing our risk factor studies, and it's going to be from a unique perspective of statewide jurisdictions, so we can jump to the next slide. So just an overview of standard number 9. This is the program assessment standard. There are 3 components to this standard. There is the risk factor study, which is a study on the occurrence of foodborne illness risk factors within a jurisdiction. There is also an analysis component to the risk factor study where you would look at the results of your study and identify areas of success and areas where you have room for improvement. And then you also have an intervention strategy where you develop a strategy to respond to those areas that are in need of improvements. In South Carolina, we completed our risk factor study in 2019. And then this year, we were partnered with the Pennsylvania Department of Agriculture as they did theirs as their mentor in the mentor-mentee relationship. Next slide.
Okay, I just wanted to start off by briefly discussing some study requirements and some variables within the study. The study must focus on the 5 risk factors. It must include data for each facility type regulated by the jurisdiction. Observations must be formatted in an in, out, NA, or NO format. Results must be analyzed and reported, and intervention strategies must be created and implemented. However, there are components that may vary within the study, especially if you end up using your own regulatory inspection forms. Some differences that our department had were the inspection forms, data input forms, facility subclassifications, the amount of inspectors that we used, and training criteria. These are definitely important items to consider when planning your study and your work plan. Next slide, please.
So again, Heather and I were partnered as mentor and mentee, and we were a good match for this. For one reason, we're both statewide jurisdictions. So a lot of what you're going to hear in this presentation is from that state-wide perspective. Since we are we're each large states, our states are broken down into regions, which was a significant component in our studies. And we both had facility classification challenges, which we will discuss. Next slide. So South Carolina's timeline, we spent a couple months, January to February at the beginning of 2019 as our sampling phase. That was followed by around a month of training. By the end of that month, we had shifted towards data collection, and that lasted until the end of June. Whenever July started through the end of August, we did our analysis of our our findings and wrote the report. And we are currently in our intervention strategy phase where we're implementing the intervention strategies that we developed after writing the report. Next slide.
So here's a summary of Pennsylvania Department of Agriculture's timeline. As you can see, it's very similar to South Carolina's. We did use theirs as an example. The exception of the year is different because we just conducted our study. The timeline did work well with the exception of the data analysis and the report timeframe. In July, we were still entering a lot of our report data collection results, and there was a time crunch analyzing the results, report writing and developing intervention strategies end of July into August. I think this is something to consider when determining timeline and resources for each step. I think this timeline is still sufficient if you have the resources, but could be difficult for those with limited staff or resources on this project. Next slide, please.
So this is just an overview of South Carolina. So as mentioned, we're a statewide jurisdiction. We have 4 environmental health regions. Within those regions, there are 16 food teams. At the time of the study, there were approximately 20,000 retail food facilities in the state, and we had about 81 food inspection staff. Next slide.
So here's a map of our statewide jurisdiction with 9 regions. While we have over 30,000 retail food facilities under state jurisdiction, the study was limited to 19,338 after exclusions. We have about 80 inspectors statewide, and 26 of them were used for the risk factor study. Our risk factor study did not include local health jurisdictions or highly susceptible populations throughout the state. Next slide, please.
So one of the early things that anyone that goes forward with the risk factor study is going to have to determine is where they're going to do the study. So in South Carolina, we decided to focus on cities, specifically Charleston, Greenville, Myrtle Beach, and Columbia. And the reasons for this was there's the highest density of retail food facilities. There's the highest amount of foot traffic. So if someone is coming into South Carolina from out of state on vacation or for another reason, chances are they're probably going to arrive in one of these cities, in particular Charleston and Myrtle Beach being tourist hubs. So we also wanted to consider our inspectors' time since our timeline was relatively tight. Sending our data collectors out into South Carolina's many rural areas was probably not the best use of our time. So we ultimately decided on this city format. Next slide. We used a 90% confidence, 10% margin of error confidence interval, and that ended up giving us 228 facilities that we needed to collect data for. That was broken down into 17 full service restaurants per city, 15 fast food restaurants per city, 12 retail food store delis per city, and 13 schools per city. If you go with a higher confidence interval, you're going to end up with a lot more facilities that you're going to need to look at. The biggest challenge that we faced in this process was identifying fast food restaurants, because we wanted to look at fast food restaurants, but in our facility listing, full service and fast food were sort of merged into the same category. So the first couple of months of our study during that sampling period, a big chunk of it was spent manually going through our facility listing and separating the fast food restaurants from the full service restaurants. With the big name chains, that wasn't too difficult, but then there's also a lot of smaller restaurants with similar processes to those types of establishments, which we, in consultation with our food team leads, were able to identify. Next slide.
So we also had a sample size with the 90-10 confidence interval. This included 216 facilities for us across all of 9 regions throughout the state. Due to several classification issues within our own internal electronic database, we were not able to further subdivide our facility types. So our facility types were retail food stores, restaurants, and schools. Coincidentally, these broke into 8 per region for each facility type, with a total of 72 risk factor study inspections per region. For the selection process, facilities were separated by facility type in our electronic database and then exported onto 3 separate Excel documents. We had an online number generator that was random that was used to choose the facilities. If it was not obvious to me that the facility did not meet the definition that we provided in our guidance, the inspector assigned to the facility further verified if it qualified for the risk factor study. The biggest challenge for us was definitely determining the retail food stores, because we were not able to further segregate deli in the deli, produce, or seafood departments. I had to randomize facilities over and over again through hundreds of facilities to get those 8 qualified facilities per region. I would definitely recommend working through any potential classification issues prior to the risk factor study. It could potentially save a lot of time. Next slide, please. So on this slide, I'm just going to go through an overview of our training with our risk factor inspectors. South Carolina had a group form training with our FDA specialists, as well as in-person practice data training at the retail food store deli in each city. Our training was a little bit different since our risk factor study was in the middle of the pandemic. We had a virtual risk factor study with our FDA specialist, which had a great overview of what a risk factor study is, the importance of it, a brief discussion of FDA's risk factor study, and gave the inspectors a good understanding of the overall what is a risk factor study and what are we doing in our inspections. And then we also had our own internal virtual training on guidelines. I went over a letter that was to be provided to the facilities at the time of inspection explaining the risk factor study. It went through marking instructions, explaining how our forms will be used in the study, and any additional information that may be gathered in the comment section that was not routine. We are currently using the 2017 FDA food code, so our marking instructions were reflected off of the Annex 4 of the food code. Next slide, please.
Another important choice that you're going to have to make if you do a risk factor study is which form you're going to want to use. So there's really 2 main options, which is one, you can use the FDA form or some approximation of it, or you can use your routine inspection data. In South Carolina, we had a lot of conversations about this in the office, and ultimately we ended up going with the FDA form. The reason why we wanted to go with this one is because it had some additional information on it that we wanted to collect, such as hand washing counts and restrictions and exclusion questions, among others. But as I'm sure all of y'all know, there's that pressure to continue routines and not slow down routines in order to do things like a data collection. So we ended up coming with a compromise of doing a routine inspection alongside a data collection. We would send in 2 inspectors to one of these facilities chosen for data collection. One inspector focused exclusively on data collection, whereas the other did the routine. This had the added benefit of an early round of quality assurance, because both inspectors could compare what they found and see if there were anything that was not similar. Next slide. Another useful tool for quality assurance that we had was the risk factor study data collection food shield site. So since we used the FDA form, we were able to enter in our data on this website. I'll have a link to it in a later slide. And really what this was able to do is if there was a typo on the data collection form and I put it into the data collection site and it was something that clearly couldn't be, the site would catch it and I wouldn't be able to submit that data collection. So whenever events like these happened, I would be able to reach out to the inspector, get clarification, and this just made my job a whole lot easier. If you're not using the FDA form and as a result the site, whoever's handling the data is going to have to pay a lot of or very close attention to the data collection forms to make sure there aren't any typos or obvious errors. Next slide.
So we had decided to use our own regulatory inspection form instead of the FDA's form. Initially, this was due to just time and resources for IT enhancements needed and the extra training that would have been needed for the new form. By using our form, inspectors already had the knowledge of how to use our inspection forms, so the only extra training that we had was some additional information needed in the comment section and going over the letters at the facilities. We did add a risk factor study classification to our electronic database, which made it easier to track and search for inspection completions. Another positive was saving time in the field. If a facility was due for its regulatory inspection within 90 days of the risk factor study collection timeframe, we used the regulatory inspection that was already scheduled. If it was not within 90 days, then we scheduled a risk factor only inspection that was not counted as a routine inspection because it interrupted the inspection frequency. Next slide, please. There were some cons of using our own regulatory inspection forms. First, you can't compare it exact to the FDA's risk factor study, even though we did try to break down the results in our report in both formats. There weren't really any other examples of how to use your own form for the study, like how to input data collection results or how to analyze the results using your own form. And like Morgan mentioned, FDA has a Food Shield risk factor study data entry site with which auto-populates the report information into Excel spreadsheets and has built-in quality assurance. We were able to make our own data input forms mirroring the Excel sheets from FDA using our own specific information and deleting any information that we did not use, but the quality assurance was on me instead of the computer. Definitely some things to think and consider when choosing which form to use. Next slide, please. And then just an overview of our data collection and quality control. We had 26 inspectors, like I mentioned, for the study. The same form was used whether it was the regulatory inspection or the risk factor study only inspection. Inspections were approved by their direct supervisors as retail food inspections normally would have been, but they also emailed them to me as well as being able to be tracked on our own electronic database. I monitored the inspections for completions. I provided backup facilities as necessary, emailed reminders to inspectors to ensure they were completing them according to our timelines. Schools specifically were closer to the closing for the year before our inspection time period was over, so that inspection timeliness had to be monitored a little bit more closely than the restaurants and the retail food stores. After I received those inspection reports, that's when I manually entered our results into the Excel spreadsheets, which calculated and formulated our final results. Next slide, please. So we both had similar challenges, even though we use different forms and processes. We both had classification issues, quality assurance issues, and time. The bulk of the time was learning about the risk factor study, facility selection process, data collection input, and the report, which included intervention strategies. One major difference with the Pennsylvania Department of Agriculture was COVID closures that we had to also get more backup inspections for, and those were especially for schools. Next slide, please.
So here is a short overview of our general findings. I'm going to really focus on the poor personal hygiene here because, as you'll see in a couple of slides, this is where Heather and I's results were most different. And whenever we were talking about this a couple of days ago and throwing out ideas, well, why is this the case? And she has a few of her own. My thought is this may be a consequence of different form selection. So one of the things on the FDA form is hand washing counts. So data collectors had to monitor for the number of times restaurant staff wash their hands properly, the number of times they washed their hands improperly, and the number of times they didn't wash their hands when required. And what I believe this resulted in is our data collectors paying much closer attention to hand washing than they otherwise would, ultimately resulting in higher out percentages. Next slide. So summed up, our main issues were hand washing, cold holding, and hot holding. Before we started our risk factor study, we expected that we would find these things. So our study sort of validated our suspicions. These were the problems that were most common across all of the industry segments, but each industry segment also had its own unique challenges. Next slide. So here is a short overview of our general findings. I'm going to really focus on the poor personal hygiene here because, as you'll see in a couple of slides, this is where Heather and I's results were most different. And whenever we were talking about this a couple of days ago and throwing out ideas, well, why is this the case? And she has a few of her own. The bulk of the time was learning about the risk factor study, facility selection process, data collection input, and the report, which included intervention strategies. One major difference with the Pennsylvania Department of Agriculture was COVID closures that we had to also get more backup inspections for, and those were especially for schools. Next slide. So here are our intervention criteria. I'm not going to go into each individual intervention strategy that we have, but I thought it would be useful to highlight the criteria that we use to determine whether we would actually intervene or not. So we determined that if an item had 30% or more out, then that item would require intervention. And the reason for this was because we wanted to maximize our resources. If we intervened on every item that had just 1 or 2% out, then that would require a lot of different strategies, a lot of different resources, and a lot more time potentially. So we wanted to focus on the biggest issues. Another thing I want to highlight about intervention strategies is if during your intervention period you need to change something up, the standard allows you to do that. So you're not locked into a single intervention strategy throughout the entire period, unless you want to stick with it. Next slide.
So here's a summary of Pennsylvania Department of Agriculture's findings. As you can see here, our highest out of compliance risk factor was protection from contamination. We looked at our elements that we used on our form and also the other categories, those secondary categories from the FDA study. So we did include those results for the secondary, and we got higher out of compliance by industry types on this end. We found out that we had a higher out of compliance specifically for specialized processes at retail and time as a public health control. So we had to include that in our results. So therefore, here are our final items that we're developing intervention strategies for: conformance with approved procedures or other for specialized processes at retail, for retail food stores and restaurants, and time as a public health control for restaurants. And then protection from contamination, specifically food contact surfaces, clean and sanitized for restaurants. Next slide, please. Oops. And next slide, please. Okay, we used a greater than 20% out of compliance for the need to develop intervention strategies. We are in the process of developing code changes, education, and training activities, enforcement and compliance strategies. In fact, next week we are starting the standardization process, and it will be one of our goals in the next year, which may change the results of our next study. Some of our intervention strategies can be immediately implemented, while others require more strategic planning as a project. An important aspect of the intervention strategy is to develop a way for the intervention strategy to be measured to see if the strategies have worked by the next risk factor study conducted. Next slide, please.
So here are my final recommendations. The first one, determine the level of statistical analysis and modeling that you want to perform ahead of time. So both Heather and I have only done our baseline studies. So we just collected the data in the field for which future studies can be compared from. So there wasn't a lot of complex statistical analysis in there. I saw a comment, how many control groups did you use? So for our baseline study, we didn't use any. And for the standard, there is no set requirement for the type of statistical analysis that you use, as long as you perform some kind of analysis. But my recommendation, and what I will recommend internally, as we get closer to the time where we need to do our next risk factor study, is to do something a little bit more complex, so that we'll actually be able to measure the effect of our intervention strategies and determine how significant of an effect those intervention strategies had in reducing risk factors. Another thing that I want to just reiterate is if you don't have a tool that automatically catches errors, like the risk factor study data entry site that we used, make sure you're vigilant and making sure that there are no mistakes on the data entry forms that you receive. And of course, use Food Shield as a resource more broadly. There's a lot of useful information on there studies from other jurisdictions that you can use as a reference guide if this is going to be your first one. Next slide.
And my final recommendations would be to pre-plan resources for time management, detecting any and solving any classification issues prior to the start of the study, and then weighing the pros and cons of using your own regulatory form versus the FDA form early enough to train and utilize any additional resources as necessary. Next slide, please.
So here's just a list of resources that you can refer to. I won't go through each individual one, but I'm sure this will be posted somewhere for you to use. These are all things that we reference somewhere in this presentation and used during our studies. Next slide. Here's our contact information. Feel free to shoot either of us an email if you have any questions after the conference. Thank you.
Thanks, Morgan and Heather. Let's go ahead and discuss our first question that we had prepared to discuss, and then as we have time, we'll go to the chat. So the first question is, understandably, completing a risk factor study data collection is a large undertaking. So Heather, this is to you first. How did you get staff buy-in and or management buy-in, especially since you did your data collection during the pandemic? How did you do that?
So the training with the FDA specialists and the internal training was very motivational for the staff, and it did explain the importance of the study. I would say continued motivation was through discussion, through weekly supervisor conference calls where I reiterated and emailing the inspectors the importance of the study and getting the inspections completed. We are very excited to expand and work on retail and retail standards. So knowing that this study is going to further improve our program is also good motivation for our inspectors.
Okay, great. Thanks, Heather. Morgan.
Yeah, so if anyone had any issue with the extra work, they didn't tell me about it, but I assume nobody likes to do extra work. So I have to assume that not everyone was super excited about doing it. But I think that the way that we did our study, the extra work was mitigated somewhat, primarily because we focused on cities. So data collectors didn't have to drive long distances to get to the data collection sites. And also, since we had multiple inspectors in the facility, that likely made things easier as well.
Okay. Now for the next question, Morgan, I'll go to you first. How did you select the people that actually went out and did your data collection? Did you just have everybody go out and receive training and then use the form, or did you select certain people?
So we prioritized our inspectors that were standardized, that they took priority. We also wanted to get a decent number of inspectors out there, though, just because we had such a short time frame. So the few inspectors that were doing the data collections that were not standardized, they were chosen as a result of conversations with their team leads, asking who do you think would be a good fit for this, also internal central office discussion.
Okay, and Heather, would you like to address that?
Yes, so we had all 9 regions as our sample area, and there were inspectors from each region that were assigned for the risk factor study. They were assigned by seniority, seasoned inspectors, and also inspectors that were available at the same time. And if they had the inspections already assigned to them, then obviously they did them. But if not, it just went by geographical area. The closest inspector to that area for those assigned inspections would have that retail food facility inspection assigned to them.
Okay, and then our final group discussion question. How did you keep everyone on the same page after the initial training as far as interpreting the question and responding correctly? Morgan, do you want to go first?
Sure. So honestly, it really depended on the data collectors. Some data collectors were very, very scheduled. I knew exactly what day of the week I was going to get there. data collection forms. But everyone's different. Some other people had a different pattern in which they sent them to me. And for those people, sometimes I would just do a follow-up saying, having any issues, how's it going? But overall, I really didn't, we didn't really have any problems. Everyone, stuck to the predetermined timeline. I think everyone understood the importance of it.
Okay, and Heather?
Like I mentioned, schools were the most difficult because of the time frame that the schools were closing before our time period was up. If it was an assigned inspection, it was already due, that was easy. But there were emails given per region, reminders of which inspections that weren't complete, and just following through on probably a weekly basis during the data collection time period.
Okay, well, let's go to the chat. There's a question from Mark about, and this is for Heather, what are the differences between your compliance form, your inspection form, and the FDA form?
The way it's laid out, a more broader, it's not broken down by categories as much. For example, cooking, adequate cooking is just all one in or out, NA and O, versus being broken down by roast or eggs or the type of meat that it is. So we have more general, it's very similar to the CFP example in the code. But the hand washing examples, we didn't use. We were using if we saw an inspector improperly hand washing versus doing the hand washing analysis. So it was just a different format. Again, it had a lot of the same information as far as the elements within the study, but just broken down in a different way.
Okay, thanks, Heather. Another question from the chat, and this is from Zahra. How did industry respond to the study? Morgan, were they receptive to you all coming in and saying, hey, we're here to do a data collection?
They were receptive, or at least no one told me that there was any issues or complaints. And I think one of the reasons for that might be because we did the joint routine and data collection. So owners weren't confronted with someone coming in doing a data collection that wasn't graded or anything. Like, they knew that they were actually getting a normal routine along with it. So that probably helped.
Okay. And Heather, I see you nodding your head. Is that the same for you?
Yeah, pretty much the same. I didn't hear any feedback that there was any negativity. We did not get any denied inspections saying they would not let us in if it was a risk factor only inspection. Otherwise, it was a routine regulatory inspection anyways. It was just mentioning that the inspection was going to be included in a risk factor study with the information focused on those 5 risk factors.
Okay. All right. Well, we're out of time today. So again, if you had a question in the chat and it was not addressed yet, our presenters will be on to answer those. So you'll get an answer either way. And always, if you have a question about the specifically about Standard 9, please feel free to reach out to one of me, your retail food specialists, and we're happy to help you with this. So thanks to Heather and Morgan for that excellent presentation. And I'll turn it back to you, Tricinda.
Thank you so much, Donna and Heather and Morgan. That was very, very interesting. We had great discussion in the chat. I know there's a few more questions. I'm sorry we ran out of time for that, but if you could please look at that, that would be great. That concludes day 2 of our general sessions. So today's evaluations are going to be posted in the chat. We also have a stakeholder evaluation for your feedback on upcoming seminars on how we move forward in 2022 and beyond. We do value your feedback. If you're interested in obtaining a certificate of attendance, you can click on the button on the homepage. I saw some chat questions on that. Thank you, Amy. She's got the slides up there. We really hope you enjoyed our general sessions. We do have our breakout sessions tomorrow, so be sure to check the time zones because each one is in a different time zone. You can attend any breakout session you want. You can bounce around to multiple ones. The agenda cards are separate when you go to the agenda on Pathable, so you can pick and choose. I'd also like to remind you that Thursday we have the workshop on the FDA Retail Flexible Funding Model, so stay tuned for that. And now I'm going to send it over to Amy from AFDO to announce the winners of the leaderboard. Amy, if you could please share who the top 3 are, and I know it was close.
All right, we have Saul in 3rd place, Jack Chapin in 2nd, and Greg Gartner in 1st.
Well, congratulations. Look at how tight that race is. Very good. Thank you so much, Amy. I appreciate that. Thank you, all of you, for joining us, and thank you for all the presenters today. You really made this a successful day. We'll see you at the breakout sessions tomorrow. Please join us at least 5 minutes early in case you have any technical difficulties. Have a great evening.